Hi, once again, this is Dr. McLaren, and I'm here at my clinic, Skin Secrets, where only your doctor knows for sure. Today we're going to demonstrate why it is so important to have volume in those temporal hollows, and we're using a product today called Blvd. This is my favorite product for this area simply because all the other fillers wear off in a year. Blvd can last up to 5 years and sometimes even longer. So whenever I'm filling this area, I don't want somebody to have to come back constantly to redo it. Usually they'll maybe do one touch-up, that should be it, and they should be able to go for several years. Jay here is an amazing candidate for this because if you look at her, she's just stunning, but she has, you know, pretty full cheeks. Everything about her face is great. She's really losing the volume here. And I can demonstrate that by showing you her forehead goes out in this nice fashion, then it goes way in here, then it goes out again for her cheeks. That happens to almost all women starting in their 40s. We call that kind of the peanut head look because the forehead goes out, it goes in like a peanut, it goes out again. Her cheeks are very beautiful, but once you put volume right here, right where my finger is, the cheek will blend into this area and they'll look so much more natural and young looking. So that's what we're going to do today. I'm going to show you, it's pretty obvious right where I need to go, I think. So this is her main area right here. And then I'm going to feather up into here so you can kind of see where I want that filler. So it's going to go right there. We've already cleaned her, but I'm going to take that white marking off now because I don't need it. That was just to demonstrate for you guys. But you will see an immediate result with this. Then Blvd will continue to stimulate and grow collagen here, so it's your own collagen that fills in that space, and it will do that over the next several years actually, but she'll really start to see a result immediately, and then it'll keep growing, and probably her best photo will be around 6 months. So Gina's going to hand me this. She has no numbing because this is a very simple procedure to do. She's hardly going to fill it. It's not like most filler. This area is actually really easy to do because patients just don't fill it much. And we're going to do this side, and then off camera I'm going to do the other side, and then you can come back and look at her before and afters on both sides. But I really want to demonstrate what it looks like just to even have one side of this done because it looks amazing. How you doing?
Great.
So I'm going to go down here a little bit. It's actually pretty fast to put in, but I'm really looking at where I'm doing it. I do all my own injections here at Skin Secrets, so whenever you come here you get me, and I am Dr. McLaren, and I have done fillers for, oh my goodness, since the 1990s when collagen first came out.
You're the best.
Thank you. Okay, I'm going to do just this little bit that's left, but you can see that's already filling out really nicely. So now I'm going to do just a little bit through here. She's unlikely to have, she's got that little bit of bleeding right where the needle is, but she's unlikely to have any bruising. She has a big event coming up, right, Jay?
Mm-hmm.
So we don't want any bruising on her.
No,
other than that tiny
really
bit
isn't
bleeding.
painful.
So now she's done. So now when you look, you should be able to see how much that filled in now. Just this fullness here where she doesn't have the peanut head anymore. She may need a second treatment in 6 months, but we want to wait and watch this grow first. So please come back and we'll have our before and afters after we do both sides. Thanks for watching.